Hello, this is Tammy Myers, and I am presenting my clinical teaching plan for Nursing 660. So my clinical teaching plan is for an obstetric clinical rotation, and my mission is to integrate classroom teaching to coincide with clinical experiences, and also to utilize the clinical instructor facilitating the clinical experience. My objectives and goals are to identify gaps between the classroom and the clinical setting and to share ways that nursing programs can bridge the gap between the classroom and the clinical setting. Finally, to develop a checklist for the optimal clinical day. My clinical objectives for nursing students would be to use critical thinking skills to apply knowledge from the classroom and lab simulations to assess pregnant patients on a labor and delivery unit. My expectation would be if they had a postpartum assignment to utilize these same critical thinking skills. The nursing student will also utilize imitation, manipulation, and precision to complete clinical tasks list in the hospital setting. And the nursing students will be able to provide care to a diverse population free from bias while maintaining privacy, dignity, and delivering exceptional care. I've been told that the definition of insanity is to do the same thing over and over again and expect a different outcome. And that's what's occurred in the nursing world when it comes to clinical education for nursing students. For many years, the same thing has happened. A group of 4 to 10 students appear in a clinical and are paired with a nurse, and we hope that they get an exceptional clinical experience. It's hit or miss. So one source says, while nursing has changed significantly over the past 30 years, methods to clinically train nursing students have not. A need exists to find innovative ways to effectively train more nursing students to better prepare them for today's healthcare environment. Amen. That's absolutely true. There are nurses who don't want nursing students. It's hit or miss. Some students get no clinical experience, and then we're surprised when they're done with nursing school and they don't know how to perform in the patient care environment. Factors that are responsible for gaps in practice: students are being used as service providers in the clinical setting. Students come to clinical unprepared and often unwilling to perform tasks. Patients decline students. There's the lack of current clinical practice among nurse educators to keep up with evidence-based information and teach accurately. Practicing nurses often lack a desire to teach nursing students. Support from the governing body in nursing, research in nursing, and a lack of opportunities for continuing education. One of the ways we can optimize the clinical experience is to utilize team-based learning in the clinical setting. Team-based learning is a situation where nursing students work in groups. A team captain is assigned, and they're graded both individually and as a team. This is super helpful in an OB clinical when the patient census is limited. In OB, this would work as a rotating team. So as as nursing students had experiences, like say they witnessed a vaginal birth, they would rotate out with that patient to postpartum, opening a spot for a different nurse to come back and have the opportunity to see a delivery. This helps in early clinicals when students' nerves are very high. And as I stated before, a team captain is established and students are graded both individually and as a team. This is a diagram that shows the sequence of events in team-based learning. It certainly starts in the classroom where they gather information and ideas. Then they go to a simulation lab and practice the information that they learned in the classroom. And then on to a clinical setting, And certainly, to bring it full circle, there's reflection and dialogue with the assignments to help gain an understanding of the learning. Curriculum mapping is another evidence-based tool that's utilized in learning environments. And the curriculum mapping is actually connecting the dots between what's learned in the didactic situation as well as the simulation lab and clinical setting. Tools that we've utilized in this particular Nursing 660 are utilized in curriculum mapping, such as e-portfolios, journaling, videos, PowerPoint presentations, all of those things to enhance learning skills in the clinical settings. Evidence-based posters are another way to utilize, fully utilize curriculum mapping. As I said, it's a connection between the didactic and clinical education. And finally, this is my favorite, the clinical checklist. So I've taught nursing clinicals for about 8 years. And for the first couple of years, I taught nursing clinicals like so many people did. I had my 6 to 10 students. They would come in. I would pair them up with a nurse and hope that they had a good day. Check on them throughout the day and try to make sure that they were getting what I thought was a full clinical experience. While the reviews were good, I felt like they were being somewhat cheated. So I developed this checklist of what I thought over 7 weeks would be the optimal OB clinical, that they would get to see or be a part of all of these listed events. So certainly a female physical assessment head to toe, a newborn baby assessment head to toe, an observation of a circumcision and the nursing aftercare, an observation of a vaginal delivery and the aftercare, hoping too that they were a part of the labor process, observation of a cesarean section in the PACU care, an AccuCheck, placement of a Foley catheter, participating in uterine fundal checks post-delivery, and then understanding and performing tests, infant tests such as the CCHD and the transcutaneous bilirubin test, and then observing the NCST PKU test. So this checklist has really enhanced the education experience of the students that I've been able to care for. And I feel like it is very helpful in any clinical setting. Finally, journaling and pre and post clinical conference. The pre-conference is to set expectations, answer questions, calm nerves of our nursing students, and it gives both me and the charge nurse an opportunity to see who we have and who we can put them with based on our patient census. The post-conference is a great opportunity to discuss all of the events of the day and answer any questions, and to tie it in with the didactic teaching that our students have had. And one thing that has been super helpful for me is to talk to my students about a peak and a pit. The pit being the thing that they like the least about this clinical experience and the thing that they like the most. And I like this because they can end the day on a positive note. And then finally, journaling their clinical day for their e-portfolio. That's tying in the curriculum mapping and utilizing e-tools, but it's also giving students an opportunity to have a record of the day so that 1, 2, 3 months down the road, where they don't necessarily recall everything they did as a busy student, but they have a record in their e-portfolio of events that they've experienced and can reflect on that and hopefully use information when it comes to taking their boards and other things like that. So that is my clinical teaching plan and how I plan to utilize my clinicals from here on out. I have listed my references and certainly am happy to answer any questions via email. I thank you for your time.